by the World Health Organization based on these new findings to redefine our approach around admission, both in terms of who is admitted and duration of admission and when to discharge. So we're going to release this new guidance as soon as we achieve consensus on some of these major issues, and then continue to learn. If we're able to do this successfully, it will have big implications on the duration of time people spend in hospitals and when they can be discharged. That will enable us bring in people more frequently. It will ease up some of the bed space and help us in some of the more practical challenges we have day to day. So that's just an example I wanted to leave with you today on how in real time new science is emerging. We're translating this into new guidance and using those new guidance in real time to change our response. Thank you very much.
The Chairman, honorable members of the PTF, ladies and gentlemen of the press, good evening. I hope you've had a good Salah break despite the challenging times we're in. Today, I intend to talk about the roles and responsibilities of the different arms of government as it relates to the COVID response. This is partly because we get a lot of questions from members of the public regarding specific issues and clarifications. So although this list is not an exhaustive one, I hope it will provide some of the information that the general public need to know. So in terms of the government agencies, obviously we have federal and state structures. Under the federal structure, we have the Federal Ministry of Health. What is the role of the Federal Ministry of Health when it comes to the COVID response? Well, first of all, they are primarily responsible for policy formulation as far as the health sector is concerned. They are responsible for providing psychosocial support, and also through the Ministry of Labor, ensuring health workers are provided with allowances, life insurances, tax rebate, etc. The Federal Ministry of Health is also responsible for strengthening and improving patient and health care through supporting state government health structures to ensure all COVID-19 patients are treated. And then finally, they are responsible for the certification of medical products. So anything you take in terms of food or drugs, working through NAFDAC, NAFDAC is responsible for coordinating this. So that's the Federal Ministry of Health. What about NCDC? NCDC primarily are responsible for the public health response. So here we are talking about provision of guidelines. For instance, we have guidelines on patient care. We have guidelines on case management. We have guidelines on burial of persons who have died from COVID infection. NCDC is also leading the effort in designing and implementing national testing strategies to scale up testing in Nigeria. They also coordinate a network of molecular laboratories for COVID-19 diagnosis across the country. But note, I said they coordinate. They do not own most of these laboratories, and neither are they responsible for the testing that occurs in most of these labs. NCDC support states in sample collection through capacity building at the state level. They also provide training to the states in terms of sample collection and testing. Finally, NCDC conducts risk communication training for community healthcare workers, as well as related public health communications and awareness campaigns. So that's the NCDC. What about the Federal Ministry of Information? The ministry disseminates information to sensitize Nigerians on the fight against COVID, as well as transparently communicate federal government activities on the emergency response. Foreign Affairs. The Federal Ministry of Foreign Affairs is responsible for mostly consular services, and they also take the lead when it comes to the evacuation of Nigerians wishing to return home as a result of the COVID-19 pandemic. The Ministry of Aviation gives access and movement rights, including essential air travel, particularly as it relates to health issues and also helps us with approvals when it comes to the delivery of commodities by air. The Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development coordinates all humanitarian activities, and they also work with state government structures on the distribution of COVID-19 palliatives. Finally, at the federal level, we have the security agencies. These are responsible for ensuring compliance with public health recommendations, all the advisories we give as it relates to COVID-19 spread at the national as well as the state level. So these are the federal structures. So last week we talked about ensuring that state governments take more responsibility for the COVID-19 pandemic. So when I say more responsibility, it means getting them to do more, even though they already have responsibilities that are clearly outlined based on the Constitution and based on the provision of health services across the country. And these key responsibilities include collating and providing necessary information to aid the state investigate cases of COVID-19. States are also primarily responsible for the provision of treatment and isolation facilities. They are responsible directly for the clinical management of COVID-19 cases in their areas of authority. They also ensure best practice, patient care and treatment according to the guidelines set up at the national level by the NCDC. State governments are also responsible for providing PPEs, which are protective equipment for health workers in the state. But this is further supported at the federal level, but it's a primary responsibility of the state governments. And then finally, state governments are responsible for sensitizing the public on prevention measures and protocols on COVID-19. Therefore, last week when we said we will be pushing this response more and more towards the state side, we are simply re-emphasizing what the states have always been doing rather than something new. But we intend to continue to work very closely with the states to make sure that this response goes down to the community level, because that's the only way we can make sure that the pandemic wanes as soon as possible. But of course, it's not just government. The public have a responsibility. We all have a responsibility. We all have a role to play. And what are some of those responsibilities? Obviously, this is not exhaustive, but when we are sick, we have a responsibility to ourselves and our families to contact the COVID hotline if we have any related symptoms. We must also provide state officials and healthcare workers with the facts, the necessary information that they would need, not only to treat us, but also to protect themselves from getting the infection. It's also part of our responsibility to comply with federal and state advisories, such as obeying curfews, practicing physical distancing, and wearing face masks. And finally, it's part of our civil responsibilities to cooperate and work with the security agencies as they deliver on their work. Of course, all of us need to collaborate with each other, because this is really a one government, a one community response. I hope this clarifies a few things. We do have a website. We will encourage you to continue to visit the website. It's www.statehouse.gov.ng/COVID-19, www.statehouse.gov.ng/COVID-19. Or you can email us directly at ptfcovid19@osgf.gov.ng, ptfcovid19, all one word, at osgf.gov.ng. Please keep on sending your questions and comments. We will read them and we will continue to address them as they come. Thank you.
Thank you very much. We have taken the technical updates from the Health Minister, the DGN CDC, and the National Coordinator. I'll now invite to the podium the Honorable Minister of State for Education.
Well, good evening, everybody. I would like to start with felicitations along the lines of our Salah greetings and come down to what today represents for us as children. So, fellow children, happy Children's Day. How are you? Many people tend to forget that we all are still children. But there are some who are, at the moment, our immediate target. Some of us have become fathers and mothers, but we are still children. In fact, this morning, we were on a Zoom call with the Honorable Minister of Women Affairs, and I explained to her that we are basically her number one children. She's our stepmother. The wife of the president is the mother of all the country. And I later spoke with my sister, my half-sister, in the Ministry of Humanitarian Affairs. And I said, it is all our job to educate our children. I'm only holding forth for all of you. So I want to use this opportunity to thank mothers. Mothers are at the head of our school system. They are the first teachers we recruit. They are the ones who tell everybody that it's time to wake up and go to school. And now that schools are closed, they're the ones acting on our behalf. Most of them have now learned how to act very well. They will wake up the children in the morning, dress them up, take them to a point and point out as if we are going to a real school. Some even take them into a car and bring them out. So mothers have learned the complete act of acting. So we thank mothers everywhere. It is also instructive that in their hands we've left many of the things that we would normally do in school. School feeding, sanitation, hygiene, and online work. So, like my colleagues at the PTF have pointed out to you, throughout this week we have been deliberating on what it will require for us to forge ahead. And on this day, that is the Children's Day, it's instructive for us to explain to them what it is that we are thinking and what it is that we're working on. We want to say, number one, the material that the chairman of PTF spoke about, which is an announcement purportedly from him that we are reopening all schools on the 8th, did not emanate from us. That is not true. The big organs you see here, all the big doctors, Dr. Yahanire, Dr. Mamora, Dr. Isani, Dr. Ihekwazu, all these people are experts, along with WHO. So whenever I bring up all this, my logic, they will tell me, look, logic is not medicine. Until we are sure that these children can go to school, return safely, and not bring home with them this COVID material, then infect people who are more susceptible to the disease than they are, then we are running a huge risk. And God forbid, in our hurry, something happens to our children. I'm not sure how anybody will be in a position to even retrieve what has been lost. So we are not taking that risk yet. We are going to prepare as much as possible within the guidance that they offer us with their expertise, working in conjunction with the World Health Organization before we reopen schools. However, for us, the plans are staggered. The tertiary institutions operate almost under a different climate from the secondary schools and our primary schools, and I'm sure you're all aware of that. So it only is fair to understand how each one works. We need to also appreciate that currently schools as institutions of learning are closed, but people who work there are still government workers. So they are not on holiday, they are actually still working. So for tertiary institutions, when people hear that University of Ibadan had its council meeting by Zoom, we sanction it. It's not against, it's not, you can't say because they are closed, because students are not in school, they can't hold council meetings. That is legitimately their work, and that is within the ambit of what government thinks all its workers should be doing. The same way we do Zoom meetings or do online meetings, that is acceptable everywhere. We also believe that those who work in universities and other institutions should use this period to either upgrade skills, take on new courses, find out what they need to do to make their teaching and learning more impactful, and use this period. It's not a waste, and let it not go to waste. So we know that the university, polytechnics, colleges of education, all their apparatus of governance must be functioning. There is no gap in those ones. For secondary schools, we expect that those who run them, our SBMs, should be also able to be looking at what they need to do to manage them. So that when we say we are ready, there will be some readiness alongside everybody. But you must realize also that education in the constitution of our country is a concurrent matter. Because it's on the concurrent legislative list, some subnationals may not be as equipped to react at the same basis with others and at the same level at all times. So we're going to publish a specification as to what we expect COVID or post-COVID reopening to look like. We are not talking about coping with COVID. There's a difference. We've come to understand that COVID may not necessarily go away. So we expect that we will adapt, that in the presence of COVID, what do we then do? Not that in the absence of it. This is in spite of COVID, we will still have to work. So what are we going to be looking at? The same things we've asked of every other institution. And this is where primary schools will then become important. For a country that has over 115,000 primary schools, you will understand that 35,000 of these who are private must agree to set up the same standards in order to allow children to go in. Number one, we want all our children, be they at secondary, primary, tertiary institutions, to come into schools by the time they would have done physical distancing. That is a very difficult thing to achieve in children. And it might even be higher for classes. If you go to our Nigerian universities, many of the things we need for social distancing may not be available. So you may need to rethink it. For instance, which courses should be in school at which periods? We can have semesters within semesters for different departments and different faculties. It is the same we're planning for secondary school reopening. We want to bring in our JS children and SSS first. They conclude their exams, vacate the place, use as much of the space as possible, and then others can return. We'll do the same thing with primary schools, where we will now limit the number of children per class. What this may mean also is that we may have classes in the mornings and then have classes in the afternoon. So whichever is convenient for you, you will now be divided. So we'll have the whole of the infrastructure we have provided can serve us at different times. I'm not sure whether there will be classes at night, but we can just deal with morning and afternoon at the moment. That is for social distancing. To organize sports, to organize events, ones that are contactless, and the ones that we can do with in different places, and use all the infrastructure of every school, so that if libraries can be, some people will be in the field learning, some people will be in classes, some people will be at different facilities within a school at all times. So the schools will be encouraged to all retool along these lines. Apart from social distancing, we are also looking at sanitary conditions in the schools. My big boss here, the Minister of Environment, has been inspecting all the schools. We intend to fumigate all and ask that suburbs in the states use part of the money we give them to upgrade the standards of the sanitation in the place. We want to be sure that every school can deploy pedal-pushed hand wash machines, locally manufactured, because we believe that this is a period where you cannot start relying on any import. This is all our research labs have developed very good ones. We've seen very nice ones from the Polytechnic in Nekede, in Kwara, in Offa, in so many ABUs area. Everybody has developed very nice ones. So we can bring all this together and we can use that as a foundation for even national industrialization. I was at the Ministry of Science and Technology over last week, and we had a good discussion over this. That will also lead us to the sanitization booths, which we are recommending that everybody gets. The Institute of Chemical Technology in Zaria has already informed the Ministry of Science and Technology that they are able to produce internal chemicals which we can bring 2-meter booths standardized by NASENI in the Ministry of Science and Technology and allowed to be produced by companies that will be licensed by the Ministry of Trade and Investment, such that it will be available everywhere in the country in almost 200,000 locations, so that people can walk into a school and get disinfected on their way going in and be disinfected on their way coming out, so that even if they've caught anything inside, they don't live with it. Those are the kinds of plans we're looking at on a broader national picture. But like I said, this all will be synthesized, and we're only giving you some sort of forewarning so that everybody can begin to plan. Those who are listening to us from here should begin to make these plans, because we don't want to keep saying we're not ready. It's a forewarning to private and state governments that the only conditions for which we are going to be reopening anywhere is that these places become ready to receive students and bring them home safely. Thank you very much.
Honorable Minister, Foreign Affairs.
Good evening, everybody. Thank you very much. I just wanted to speak on the latest situation and development with regards to evacuees. First of all, I understand with regards to evacuees in the United Kingdom that they have been made aware through a publication from the High Commissioner of the United Kingdom here in Abuja, that there will be 2 or possibly 3 flights coming into the country to evacuate British nationals. As you know, of course, the last time there was such a flight, we were able to have our people in the UK board that flight coming here. The situation with the flights now coming is that the UK government, which is effectively chartering these planes, in the contract that they have with those companies, there are provisions not to carry anybody coming to Nigeria on that first leg. So their contract is only to carry passengers going from Abuja, from Nigeria to the United Kingdom. So it will not be possible. But furthermore, it also would not have been possible because the plans that we have in place is to use a Nigerian carrier to evacuate Nigerians from all the countries around the world where we have an evacuation operation, unless it is absolutely impossible to do so. So the plan that we have and still have is that at such a time where we evacuate from the UK, that hopefully we'll be able to use a Nigerian carrier. Then the other thing is that, as you know, up to now, everybody that's coming into the country has to be quarantined for 14 days. These evacuees have had to be quarantined for 14 days at a hotel designated by government, and all the medical requirements would have been in place in respect of those hotels, undertaken by the medical authorities here. Now there's going to be a change to that procedure and that protocol, and that is going to affect the timing of any further evacuation we're going to undertake. Essentially, we will have a situation, we hope soon, thanks to, and again express our profound gratitude to Aliko Dangote and others in the private sector, have testing units put at airports. The medical people can, correct me or add to it, and so anybody that is going to be evacuated will first of all have to undergo a test from the country that they're leaving from at least 5 days before travel and not later than 9 days before travel. That will be a precondition for boarding the flight to come to Nigeria. So a pre-flight test. And if they're positive, of course, they will not be able to get on the flight. If they are negative, they can get on the flight. But arriving in Nigeria, Abuja or Lagos, Aliko Dangote and his other partners will have in place these units where they will take samples from the passengers coming off the plane, and they will retain the passports of the passengers, and the passengers, and this is the big difference now, will then be able to go home and not into a prescribed hotel to self-isolate. Results from those samples would then be available within a day or two. And those who are positive, of course, will be taken in for isolation into isolation centers. And those who are negative will then have to spend more days to complete the 14-day period, after which they can come, collect their passport, and go their way. But as I said, all this will be taking place in their own premises, under self-isolation. So the whole issue of quarantining in hotels will no longer be necessary. This will probably also mean that we can be, more people will be able to come back. Hopefully, the frequency of of the evacuations, and it'll be a lot easier and less wieldy than it has been up to now. So, and what we've been asked to do essentially is to cease suspend all evacuations for now until this new structure is put into place, and hopefully, and we're very hopeful that maybe by next week we should be able to commence evacuations. But as I said, the fact that isolation at home and then the possibility of now going to Lagos, as the large number of evacuees prefer to go to Lagos, we believe that should make things also much easier for all concerned, including the evacuees. And then maybe just an update. I'm sure some of you have, or most of you have seen in the media, after the evacuees from Saudi Arabia, who are still now going through their quarantine, we also, in cooperation with the government of Lebanon, were able to evacuate, in total, actually 69 Nigerians, 50 trafficked Nigerian girls from Lebanon, and 19 other Nigerians, and they all arrived safely and are in quarantine. We again, express our thanks to the government of Lebanon for helping to facilitate this, and also the Lebanese community in Nigeria, who actually funded the cost of the flight and cost of hotel for the 50 trafficked girls. And I think that this was obviously showing also their disapproval of a lot of what has been happening in their country with respect to these trafficked girls. So they are now also in quarantine, and so far so good. And then the other batch of evacuees, you'll recall the batch from the United States and the batch from the, I think it was the United Kingdom. We've also been able to return their test results, and they've all been able to now leave quarantine. And those that needed to go to Lagos, arrangements were made, and they were able to fly to Lagos. So all we have at the moment are the evacuees from Saudi Arabia and the evacuees from Lebanon. We know that there's a large number of Nigerians still waiting to be evacuated. In addition to London, of course, there's China, and that's been a real issue because the circumstances are ones that we're not altogether happy about. We've discussed that in the past, and it's a real priority for us to get all the evacuees back, but we know that those in China are facing very special challenges, and it's a real priority for us. And as soon as this mechanism is put in place, I would like to assure them that we will do everything possible to prioritize their return. Of course, we have evacuees from almost all over the world. We as Nigerians, we travel all over the world, and they're all priorities. The U.S. has a large number that are still wanting to come back, and of course the U.K., France, Turkey, Sudan, Malaysia, or Thailand. So we still have a lot of work to do. But this new mechanism, I think, gives us greater flexibility and will make it possible, hopefully, to be able to bring back more of our people without too much of the constraints. Because, of course, one of the major constraints in the past has been the limited number of hotel space available. But they will be able to come back as quickly as they can be tested on arrival at the airport. That's really the only constraint that we'll have in bringing them back. Thank you very much.
Honorable Minister, Environment.
Mr. Chairman, members of the PTF, ladies and gentlemen and ladies of the press, good evening. Just a little update from the Federal Ministry of Environment. By now, we have commenced decontamination and disinfection in all the 36 states, specifically the 6 geopolitical zones and FCT, making the 7. What we intend to do is to go zone by zone. We have enough teams that will be working simultaneously because a lot of businesses or schools will be opening. So we are making sure that we are working concurrently in all the areas. Specifically, I would like to dwell on the issues of reopening schools. And that I will do in Hausa. Because it's very important, as the minister has mentioned, that we take care of our schools. We make sure that they are totally decontaminated and disinfected before the children move in, as they are our asset. Jama'a assalamu alaikum. Ina so ne dan yi bayani akan abubuwan da ma'aikatan muhalli ta yi daga baya zuwa yanzu. Da farko dai ina ma kowa barka da sallah da fatan an yi sallah lafiya. A yanzu dai mun fara ayyuka a dukkan shiyoyin ƙasar nan guda 6 har da babban birnin ƙasa. Amma ina so ne in magana musamman akan buɗe makarantu. Mutane kila suna tunanin to yaushe za a buɗe makarantu da na firamare ne da na gaba da firamare da jami'o'i, kuma in an buɗe ya zai kasance yaya yaranmu. Wannan abu ne wanda yake wannan kwamiti ya zauna ya yi tunani a tsare-tsaren yadda za a buɗe, kamar yadda kwanakin baya aka sassauta dokan zaman gida aka yadda a fito awa kaza, to makarantu su tsarin yadda zai yi shi ma dole akwai nashi tsarin. Idan kuka duba a nan yadda kuke kallon mu za ku ga yadda aka wawware kujeru. To tsarin ita wannan cuta kamar yadda muka faɗa baya shine a tabbatar ana tsaftace hannuwa, a tabbatar ana bayar da tazara wajen mu'amala da dukkan sauran abubuwa. To abin da zai faru a makarantu kenan. Bayan mun tabbatar da cewa mun tsaftace su, an yi feshi, to kuma dole za a sake sabon tsari ne a wajen zama. Yanda da yara suke zama kusa da juna ba zai yiwu ba, domin kasashen duniya da suka fara budewa abin da suka yi kenan, kuma ana samun wato ci gaba a kai. Saboda haka za ku ga cewa an cancanza, dole a rage yawan azuzuwa wanda da ana dunkule wuri guda, dole a san tsarin da za a yi a canza domin a tabbatar da cewa wannan tazara ɗin da ake magana wajen mu'amala an samu. Kuma idan muka tsara waɗannan tun daga matakin firamare har zuwa sakandare zuwa jami'a, abu ne wanda yake dole sai an yi sabon tsari, kamar da na ce ba lalai ba ne ɗakuna ko kuma azuzuwan da ake da su isa. Saboda haka har ila akwai sabon tsari. Wannan cuta ta zo da abubuwa, kwanaki na yi bayani da cewa idan zamani ya zo sai ka san yadda za ka bi. To an ce sanin halin mutum sai ka ci maganin zama da shi. Yanzu mun san tsarin corona, sai mu san irin yadda za mu yi domin mu zauna lafiya. Kuma ɗaya daga cikinsu shine wannan abubuwan da za mu yi makarantunmu, don saboda mu tabbatar yaranmu sun je makaranta lafiya, sun dawo lafiya ba tare da sun samu wani abu. Duk waɗannan tsare-tsaren da ake yi, Allah ya kiyaye, ko da ba a sani ba da akwai wani da yake da wannan cuta, idan aka bi waɗannan tsare-tsare kowa yana saye da wannan takunkumi ɗin, domin a makarantun ma za a sa, domin muna gani. Har ila yau akwai kuma wani tsari da shi ma duka ana yi dai, wanda zai ƙara tabbatar da lafiyan yara kafin ma su shiga aji. In suka zo akwai tsari na yadda za a fesa musu abin da za a tsaftace jikinsu, ko da waɗansu ƙwayoyin cuta, wannan magani zai iya kashe waɗannan ƙwayoyin cuta ba tare da kuma ya cutar da yaro ba. Domin ina jin ki da yawan ku sun gani ma a talabijin yanda ake shiga ake wucewa kamar ta ɗan wani kwararo haka, wanda za ku ga kamar ana fesa tiriri ko hayaƙi ko wani abu. Wannan abu ne wanda yake yana kashe duk waɗansu ƙwayoyin cuta da za su kasance a jikin mutum, har ita wannan ƙwayar cutar corona ɗin. To akwai tsari na duba yadda za a yi ma a makarantu da offices da wuraren da ya kamata a yi wannan cuta ne wanda ta zo kuma ta addabi duniya, kuma duk abin da aka yi a waccan ƙasa in dai abin a hana wannan yaduwar cutar ne to daidai haka za a yi a wata ƙasa, ko da yake kowace ƙasa da ƙarfinta akwai kuma tsare-tsare yadda za a yi dai a tabbatar an yi wani abu da zai kare lafiyan al'umma. To makarantu idan lokacin buɗe su yayi, tsarin da za a bi kenan yana da kyau ku sani, shi yasa shi ministan ilimi ya ɗauki lokaci ya yi cikakken bayani. Mu kuma Allah da za mu tabbatar mun feshe waɗannan makarantu domin mu kare yaranmu. Amma wannan kuma daga iyaye su ma akwai nasu rawar da za su taka. Dole ne su gaya ma yara su bi tsarin da aka sa su bi, ba a sa yaro wani abu bai je na wani abu daban. Iyaye suna da rawar da za su taka muhimmiya, domin wani abu ne wanda yake gwamnati ba za ta iya yi ita kaɗai ba, dole sai da haɗin kai. Kama wannan dokan zaman gidan da wani lokaci mutane za su yi ta kwaranniyan son fitowa, don mu ake yi ba wai kawai don jin daɗi ba. Wannan na faɗa kashi ɗaya, kashi biyu, kashi uku, kuma kila za ku sake ji, domin wannan cutar fa tana nan tukuna. Ba mu san ran da za a ce ta tafi mun koma muna yawon mu muna jin daɗin mu muna shargallan mu yadda muka saba ba. Zai ɗauki lokaci, to gara mu koya mu saba, ya zamana kaman wani cikon abu ne na rayuwarmu na yau da kullum. In muka bi cikin lokaci kalilan Allah yadda wannan cutar za ta wuce, za mu iya komawa. Amma in ba mu yarda mun ba, to shine fa za a dinga samun matsala, tana karuwa tana yaduwa. Allah ya ba mu ikon bin tsare-tsare da dokokin da ya kamata mu don kare kanmu da yaranmu. Assalamu alaikum.
Thank you. That closes the update session. We shall now take your questions. If you're ready. Okay.
Good evening, sir. My name is Friday Okeribu. I'm a reporter with Channels TV. I'd like to direct my first question to the Minister of Foreign Affairs regarding the update he gave concerning the evacuees from United Kingdom and the United Arab Emirates. The tests that came in, those who were negative have been reunited with their families, if I got you right. I'd like to know how many of them tested positive for COVID-19 in terms of number. My second question, I would appreciate if the Minister of Health or the DG NCDC can actually provide answer to that. It has to do with the index case in Benue that was discharged last week. A recorded video on the day she was discharged, which of course a press release from the National Hospital made available to journalists also supported, shows that at the point she was discharged, she was still positive. She was not negative. But a statement that was sent by the hospital says that she's discharged because she has stayed beyond 45 days. I'd like to get further clarification. Does that mean that if someone who is positive stays beyond 45 days without showing any symptom, he can no longer transmit that disease to someone else? Or what is the rationale behind discharging her when she's still testing a positive for the virus? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo Balonya. I'm with the Sun newspapers. Minister of Foreign Affairs, I would like an update on the Canadian evacuees, the issues with Air Peace. I would like to know what's the update. And second one is, though you have said something about China, I would like to know, you did promise to seek compensation where necessary from the Chinese government because of the way our citizens there have been treated. So I would like to get an update on that. The coordinator, please, I'd like you to react to the assault. A doctor on essential duty was assaulted in Port Harcourt on her way to work, and her community Polo Pubu in Delta State is demanding justice and wants to know what the PTF is doing because she was on essential duty when she was assaulted. Thank you.
Mr. Chairman, members of the PTF, my colleagues, good afternoon. My name is Nancy Oyedia Orom from AIT. So I want to start with you, the SGF. A journalist had an investigative investigation across the city center, and he actually found out that security personnel who are stationed at the Eagle Square, now there are 7 under the federal government, not the FCT, have not been paid their allowances. Now their counterpart, there are 7 under the FCT, got some form of a palliative and allowances. The 7 under the federal government said they don't have masks. So I want to ask, is there a way we can engage security chiefs on allowances for this security personnel because they are critical stakeholder in the fight against COVID-19 so that they are not unduly induced with paltry sums? Now my next question goes to the Minister of Education. So during this lockdown, you've spoken so much about e-learning. You talked about radio, television, and also internet. Now, for those who are going to be learning through the radio and television, I know that education is not a one-way traffic. You give and you get response from this student. How do you intend to get this feedback mechanism from these children? Mr. Digisa, the last time your team went to Kogi State, it wasn't a palatable one. So I want to know, have you made any other effort to lend helping hand to Kogi State? And finally, to the Minister of Environment. I know that the Minister of Education said there are plans to decontaminate schools. I want to know, these schools, the private schools, are they also involved in this decontamination? Because there have been several allegations. A lot of people said that AEPB are charging them 120,000, some said millions. I want to know, for private businesses who want to decontaminate their offices, how do they go about it? Thank you.
Good evening, sir, the chairman of PTF and the members. My name is Musa Aminu from Voice of Nigeria. I'm going to ask in Hausa language. Okay. There are some states that didn't obey the lockdown during Salah celebration. And the chairman of the PTF said the school will open, or rather the Minister of Education, the school will open soon. Does that involve those states that didn't obey the lockdown order? So abin da nake tambaya shine akwai jihohin da ba su bi dokan wato a zama gida ba lokacin bikin sallah kuma an ce makaranta zai bude nan ba da jimawa ba. Shin wannan doka ya shafe su, bude makarantu zai shafe su ne ko akwai wani mataki da za a dauka a kansu?
Good evening, Mr. Chairman, members of the PTF, my colleagues. My name is Mohammed Saliu Nazif. I work for Voice of Nigeria. My question goes to PTF Chairman. Sir, recently, there is a recent focus by the Food and Agricultural Organization of the United Nations, that's FAO, which indicated a risk of locust invasion in West African countries from next month, that is June, down to September. What is the federal government and state government doing in preparedness and anticipatory actions plans to control this ugly development? We know, especially we that came from the northern part of the country, even from this northeast, Mr. Chairman, you will confirm to that. Whenever this locust crosses our border, it causes a lot of damage to our food productions. Is there anything, because of this forecast, June to September, anything government doing towards that aspect to control it? Thank you.
The chairman of the PTF, members of the team, my colleagues, my name is Amaka Ude. I report for Arise News. Well, my first question actually goes to the Minister of State for Health. So I want to get an update on the hazard allowance and insurance for frontline workers. I'm asking for an update because the last time I asked the Minister of Health on the implementation date. He said that was still being worked on. And I'm sure you're aware of the situation in Jos, where the nurses have actually withdrawn their services from the isolation centers because, according to them, no hazard allowance, no insurance. So we need an update on that. And also, I know that the Ministry of Health, there was a committee of experts that was set up. What are they telling us about the strains of COVID-19 in the country? I ask this question because some experts, epidemiologists who are Nigerians, they say if we know the strains of COVID-19 that we currently have, this will help us reduce our case fatality rate. So what is this committee telling you that can help us reduce that? And my next question actually goes to the DG of the NCDC. Let me start, first of all, with an update concerning the reagents you told us we're expecting. Are they in the country now? Have you received them? And how much boost have we gotten in terms of our number of test kits in the country that we know some states have continued to lament about not having enough? And also, the last time I asked you about how much each test cost, you told us it was between $15 and $20. And Lagos said they have conducted 16,000 tests, costing them about 800 million naira. The Commissioner of Health, Professor Akin Abayomi, says it costs them between 40 to 50,000 naira per test. So I want to know why there's a difference between their cost for tests and that of the NCDC. Thank you.
Good afternoon, all. Rachel Abuja from the News Agency of Nigeria. My first question is to the Minister of State Health. Sir, you made mention of research. I would like to know the area or topic being considered for funding apart from the alternative medicine. My next question is for the coordinator. Sir, I would like to know if we're looking at acquiring a contingency reserve for inventories like PPEs, ventilators, and other consumables. And I also want you